Good afternoon, and again, thank you for joining us. I'm going to take my mask off just for better audio quality, but again, important health safety is to be wearing our masks. I'm sure there are a lot of questions as there's a lot of things going on currently out there, so I'm going to make a brief opening statement and then we'll get to your questions. First and foremost, Northern Light Health has been anticipating the possibility of an uptick in cases this fall. We've been preparing since the beginning of this year for this, and we are in a good position to safely and confidently meet the community's healthcare needs related and unrelated to COVID-19. While our protocols have changed a bit to keep everyone safe, like we're offering telehealth for a lot of our outpatient visits, our doors remain open and we continue to provide our full range of services. Remember, we are here to help you. Currently, as of this morning, there are 44 total inpatients within our system. 20 of them are at Eastern Maine Medical Center, 2 are at A.R. Gould Hospital, 1 at Blue Hill Hospital, 2 at Maine Coast Hospital, 1 at Mayo Hospital, 6 at Mercy Hospital, 2 at Sebasticook Valley Hospital, and then 10 patients being treated at our home care and hospice in their own homes. I did want to make a brief word about Acadia Hospital. As of Tuesday morning, Northern Light Acadia Hospital recorded its third pediatric inpatient who tested positive for COVID-19. The other 2 patients had tested positive earlier in the week. As of today, there are no patients at Acadia Hospital who are positive for COVID-19. I'm happy to say that those 3 individuals went home with their families. The hospital is working closely with the Maine CDC to assure we are following all protocols for testing and infection prevention moving forward. Acadia has suspended visitation and admissions to the pediatric unit and will reevaluate this decision on a daily basis. I am very proud of our staff there as they contain this very quickly, and the fact that they adhere to our personal protective equipment and infection prevention control measures limited the spread so far in their facility. So with that, we'll open it up for questions, and Paul and I are here to answer what you guys got.
All right, first we have Ellsworth American, Anne.
Hi, thank you for taking my question, Dr. Jarvis. So a second Hancock County COVID death was recorded today, and I'm asking what hospital, if it was a local hospital that this death happened in.
I'm sorry, I just don't have any data specific to that particular case. And as per usual, we try not to comment on any specific cases, even if I did have information, but I'll refer you to the local hospitals for any comments on that.
Thank you.
And do you have a follow-up question, or is that it for today? Oh. Sorry, Anne, did you have a follow-up, or is that your only question?
Yeah, a little issue with my mute button. No, that was the only question that my editor wanted me to ask you today, so thank you.
Yeah, well, our sympathies go out to the county and to the families of every individual affected by COVID-19.
Okay, next we have Leslie Landrigan, Penobscot Bay Press. Your mic should be live, Leslie.
Sorry, I had problems unmuting. Dr. Jarvis, what can you tell us about the Island Nursing Home? I know that Northern Light has been working with the nursing home.
Sure, so the question was about the Isle Nursing Home on Deer Isle. We are aware that a significant outbreak occurred at that facility. Northern Light Health Home Care and Hospice have been assisting them both in testing and in some staffing, and we are aware that they have reached out to the National Guard as well. It's a sad situation, but I believe that conditions are improving there. And again, for any further details, I'd ask you to just reach out locally to the Isle community.
Okay, thank you. No other questions.
Okay, next we have Kelly Bushard, Portland Press Herald. You should be able to unmute.
Hi there. Hold on just a second, please. Yes, I was under the impression there was going to be some discussion of vaccination preparation by Northern Light Health facilities. And I don't know if that is still planned in this presentation, or if you could is if I could ask some questions around that.
Yeah, please do. I'm more than happy to speak about that. In addition to my role with the COVID Incident Command, I'm also the incident commander for our mass vaccination program as well.
Okay, so I am interested to, I would like to understand what preparations are being taken at this time. If you know how many vaccinations your facilities will be receiving, if you have the necessary freezer, the super freezers that will be needed to store them, and what sort of steps you're taking to deploy, decide. I know that a lot of this is early and many are waiting for further guidance from the CDC, but I'm guessing that you're trying to ramp up as you wait for further information. What can you tell me about those sorts of things?
Excellent questions. Just to kind of talk about our vaccine preparedness. So we have been coordinating with the state on a regular basis. I think that's one of the things that you've heard me say before. I am so thankful to live in Maine, where across the state, not only our state agencies but our separate health systems see each other as kindred spirits in this pandemic, and we continue to work together both for treating COVID-19 patients, but also in the vaccination process. So where we're at today and what we know, yesterday the advisory committee on immunization practices met and had an emergency meeting. They have advised that phase 1A of vaccine distribution should be for healthcare workers and individuals who are residents at long-term care facilities. Further details on that are still to be coming to us. Later this month, the FDA will take up an emergency use authorization request by Pfizer and most likely Moderna. The Pfizer product is the vaccine that requires that ultra-cold storage unit. And I will say that while Northern Light Health already had freezers that were able to meet that standard, we did go out and purchase 4 more, and they are located across the state in order to ensure that if we were to receive that vaccine, that we could deploy it as we needed to. Because the initial use will most likely be for healthcare workers who work directly with individuals who are positive for COVID-19, that will be where our first distribution will be looking at and operationalizing. It still is unclear from a state and federal standpoint who will be the leading agency to be doing vaccinations for long-term care residents, but we are ready to assist if they ask us to do that. We continue to work behind the scenes to come up with our own safety protocols. Before we do any vaccination at Northern Light, our own internal formulary review committee will review the data that comes out of both the FDA and the Advisory Committee on Immunization Practices, and then we will roll out our strategic plan. Like I said, initially that will be targeted towards healthcare workers and most likely sub-targeted towards those that are directly working with patients who are known positive for COVID-19. From there, we will expand out to more healthcare workers, to other high-risk groups and high-risk individuals, and hopefully we will see that sometime early in the spring, we will be talking about vaccinating the general public. So that's where we are today. All of that is subject to change almost on an hour-by-hour basis as we gain more information and the process continues to be followed. So we will continue to provide periodic updates, particularly if any breaking news occurs.
Can you tell me, you have purchased 4 additional freezers?
That is correct.
And how many did Northern Light Health facilities have before that among your?
Yeah, so I don't know the exact numbers of what we had before. Most of those are in use for some other purpose, and we would have had to repurpose them. Because of the size of the freezers that we have and what we expect as shipment containers for our vaccine, we actually feel that the 4 new freezers that we bought will be sufficient to meet the needs of the state of Maine.
Okay, thanks, Kelly. And now we'll move on to TJ Tremble, Fox ABC Maine. TJ, you should be able to unmute now.
Thank goodness. Dr. Jarvis, how are you today, sir?
I'm well, TJ. How are you?
Getting better every day. I'm wondering if you can tell us, number one, what the capacity right now at EMMC is for COVID patients, how close you are to that, and what the plan is if you hit that.
So we have always had a strategic plan for managing whatever surge of patients, whether those be COVID-19 patients or any other patient that needs our services. And so we monitor that on a daily basis. Sometimes when we have a critical number of individuals in-house that we monitor that more often. So last week I certainly presented numbers a little bit greater at Eastern Maine for total positive patients. So we have a surge plan that we use for that, and it is a very varied phase plan. So right now we feel that we have adequate resources to care for the needs of all of our communities, not just here at Eastern Maine Medical Center, but across all of Northern Light. We have adequate supply of ICU space and ventilators if we needed to utilize those. But I will say that we are concerned and continue to look at the numbers. The numbers of total cases across the state are rising, as are the number of hospitalizations across the state, and that becomes a challenge for us. The state of Maine has always been challenged for bed capacity. We don't have the right number of hospital beds for the number of our population, and so that becomes a struggle for us on a regular basis outside of dealing with the COVID-19 pandemic. So that just adds yet another problem for us to solve. But right now we are looking like we are in good shape, that we can continue to maintain our facilities and our services like we have been, but we will continue to monitor that and adjust as we need to.
Could I just follow up with a quick question regarding the vaccines? There was some discussion just a couple minutes ago. When are you actually expecting, if all goes according to the plan, the first shipment of vaccinations to arrive at any of your facilities?
So shipments of the vaccine are controlled by the federal government. We do expect that if everything goes with approval process and that safety and efficacy are found to meet the criteria that are necessary for a vaccine to be distributed to the general public, that sometime after the 15th of December would be when we would expect to receive a shipment. We do not know how much that would be. I know that the Maine CDC had given some details about that at their briefing earlier this week. But all of that is still up in the air, and oftentimes, as it is with COVID, we find out almost at the last minute when things are going to occur. That's no different than some of the biologic agents that are being used to treat individuals with COVID-19, where we find out almost the exact same time that you find out that they have been shipped and received.
All right, next we have Amy Brown, WERU.
Thank you. Keeping on the line you were just going on with treatment, we've had a lot of questions from listeners about the efficacy of things like vitamin C and D and zinc for preventing COVID or perhaps even treating symptoms with people with milder cases. Some people have said that President Trump was used as part of the protocol with President Trump. Is that something that that Northern Light Health is advising outpatients or treating inpatients with, any of those kind of vitamin cocktails? And also adding on to what you were just saying, what are the effective treatment protocols that you've learned over the past few months?
So Amy, that's an excellent question. So the question was, are we using any therapies involving vitamin nutritional support for patients with COVID-19? And then the second question is what are we actually doing? So to answer the first question, no, we are not recommending that anybody do anything differently than their own daily activities as far as prevention of COVID-19, except for things like wearing your face covering, staying 6 feet away from other individuals when you're outside, and staying home when you're unwell. That's the best way to prevent the spread of COVID-19. Everything else is anecdotal, no science behind them, and I would not advise anybody to do something differently than what their own healthcare provider has advised them to do in order to keep themselves healthy on a regular basis. Wearing your mask, that's how you prevent the spread of COVID-19. As far as treatment goes, we have learned a lot since this pandemic began. We are treating far more patients on the outpatient side than we were before, because we know that for most people, they just need supportive care, meaning that they need to maintain hydration, and continue to do good nutrition, and if they have respiratory symptoms, that they need to seek attention. In the hospital, we have learned that oxygen therapy is one of the primary ways that we have been treating people. We also know that early ventilation or putting somebody on a ventilator is not the correct thing to do, so we delay that now more than we did in the beginning. And then we're lucky because we have other treatment plans that we can use. Remdesivir was a drug that was approved for the treatment of individuals with severe disease, and we have been using that at at our facilities, as high flow oxygen as well. There is the addition now of a new agent called a monoclonal antibody, which are antibodies that are targeted towards the COVID virus. We hope to be able to utilize those shortly. That is actually for people who have mild to moderate symptoms and are not being hospitalized in order to help keep them from getting so sick that they need to be hospitalized. So you'll be hearing more about that in the coming days to weeks here in the state of Maine. Beyond that, most of our treatment really is supportive, and sometimes it's targeted to the individual based on their own healthcare problems. And then lastly, using dexamethasone, a steroid, has also shown to be beneficial as well. And so using all of those to our advantage, we have seen that we've been able to keep people out of our intensive care units, though they may still need to have some of our normal medical care inside a hospital. More importantly, we've been able to keep more people at home, which is all good news for us.
Great, thank you. And can I ask one more, Chris? Or I just use my questions up?
Yeah, go ahead.
Okay. How are you doing on PPE and testing supplies? Any delays on the testing and any shortages with the increased cases?
So I'll talk about personal protective equipment, or PPE, first. Right now, we have an adequate supply. We have been very proactive in that arena since this began. I give all the credit to our supply chain personnel, who sometimes call up to 250 companies a day to ensure that we have the necessary tools to keep not only ourselves safe, but keep our patients and their families safe when they enter into our facilities. And so right now, yes, we feel that personal protective equipment is not the weak spot for us, and we will continue to manage that as we need to. Still is a concern, as you mentioned, as we see increased cases. Testing continues to be a challenge across the nation, and particularly here in the state of Maine. The supply chain for testing is not as robust as it is for personal protective equipment, and so we need to manage that on an effective basis. For many individuals, they will see a delay in their test results, particularly if they are being tested for asymptomatic reasons, such as they had a very mild exposure, or they traveled outside the state and they're trying to reduce the amount of time that they need to be in quarantine. Those are not our priority tests. Our priority tests are for those where it is clinically indicated, so those individuals who are symptomatic, particularly those with health conditions, and those that are being admitted to our hospitals, as well as those who are undergoing certain procedures and surgeries that we require that test in order to keep ourselves safe as well as our patients. And so yes, testing continues to be the struggle for us. I sound like a broken record. I started talking about that way back when we started these back in March and April, and I continue to say the same thing now. The supply chain for our testing supplies is hampered, and we need that to be improved. But we will do everything we can to continue to test people when it's appropriate, and to make sure that we are meeting all the clinical needs of our community. So thank you for that question.
All right, next up is Jim Keithley, WMTW.
Thank you for taking my questions. Mine also related to the rollout plans for the vaccine. Some of the questions I had were answered, but I think people watching tonight, everybody understands the healthcare workers, the people in long-term facilities need, obviously will get the vaccine first, but the general public, what can you tell them about a potential timeline when they can expect that a vaccine would be available to them, and what might it look like up in your area? I understand they may transform some of these swab and send sites that are doing the testing and maybe where they do vaccines. What do you envision in your plan when it comes to vaccines for, again, the general public?
Excellent question, Jim. Thank you for that. So the first question was about when do we think the timeline will be that we'll be able to expand out vaccination to the general community. There's a lot of factors in play there. The first of which, of course, is approval of vaccines for use. There are 3 that are very close to approval. Each one of them is a little bit different in the way that its rollout will be, and the manufacturing occurs. And really, it's going to come down to manufacturing once that safety approval has been made. How quickly can they make the vaccine, and how quickly can they distribute it across the United States so that we can actually then start to give it? So that's why I continue to give continue to say the message. I'm looking at early springtime for that. I know there are other people who've been hopeful that by the first of the new year we may be able to. That would be wonderful if that's the case, and we will be prepared if that's the case. But I am not quite as hopeful on that front, only because I know that the process is rigorous to get that safety approval, and we want to make sure that it's safe before it comes. As far as how we will distribute it, it will be in multiple phases, because many of these, particularly the very first vaccine that will most likely be approved here in the United States, is fragile, and therefore requires that it is kept under certain conditions, that we will have to be a little bit more controlled than, say, we do with the influenza vaccine, where frankly you could get it just about anywhere. So yes, we will most likely be utilizing our swab and go sites across the state to be able to facilitate mass vaccination. We will also probably set up some specialized clinics that will be able to do that. Unfortunately, this will most likely not be a vaccine that can be given at your local doctor's office or at a local pharmacy, at least not in the short term. Perhaps in the long term that will change. All of those are being looked at, and again, we are doing our pre-planning so that we'll be able to roll this out as quickly as possible in the safest and most effective manner possible. So thank you for that.
Okay. And I don't know if you want to chime in on the second question I had was, vaccine, even though people are going to be vaccinated down the road, there was talk of, it doesn't mean you're given the green light to throw away your mask, that probably we're going to be mask wearing through all of 2021. Are you hearing that as well? Because we don't know how and when and how long the studies take to find out if these vaccines are, providing immunity.
That's correct. So the question was really, once you get a vaccine, can you stop doing all the other precautions that we've been talking about? And the answer to that is no. I fully expect that through calendar year 2021, we will continue to mask, and that when you come to one of our healthcare facilities, we will require you to mask, as we require our staff to mask and actually wear eye protection as well. So we will probably continue to see that all the way through 2021 and possibly into 2022. Why is that? It's multifactorial as well. So first and foremost, everybody would have to be vaccinated, and the vaccine would have to be 100% effective for us to say there's no more virus. We know that's not going to be the reality. We don't see that ever with influenza. So during influenza season, we continue to tell people that they need to do good hand washing, even if they've been vaccinated, because no vaccine is 100% effective and no area is 100% safe. That will continue with coronavirus that causes COVID-19 as well. And so getting a vaccine is not your ticket out of what we're dealing with right now, asking you to stay home when you're unwell, staying away from mass gatherings. Those need to continue, and you must need to wear your mask. When will that happen? Unfortunately, that's not something that I can say or predict, and nor do I think anybody is predicting that. And if they are, I would probably change the channel to a different news station because that's not appropriate information at this point. Appropriate information is continue to do all the things that we need you to do. Wear your mask, wash your hands, stay 6 feet apart, don't go out when you're not well, don't go to mass gatherings, don't do those things because we need you well so we can continue to do our job because we need to stay well also.
Okay, Blair, WGME, you're up.
Thank you. So along the lines of vaccine distribution, I know you said you bought 4 more freezers for the vaccine, but what more specifically is Northern Light doing? Are you hiring new staff members? Are you having to train those staff members specifically to be able to give this vaccine?
So that's a great question, is how are we going to staff to be able to do all this? The good news is that we do this year in and year out. Every year during influenza season, we are able to vaccinate all 14,000 of our employees and countless number of patients and community members. So we're all well prepared to do that. If you remember back in 2009 when we had the H1N1 outbreak, Northern Light Health, as well as our local partners and communities and other agencies around the state, stepped up and were able to vaccinate as many people as we could in a very short period of time. We can do this. This is one thing that healthcare does very well, mostly because we believe so much in vaccines. So we have staff that are already trained. We can bring in extra staff as we need to staff up for particularly high volume clinics and things like that. But we do this very well. We do this very safely. And we are confident that we will succeed once we get to a point where we need to do mass vaccination.
Okay, perfect. Thank you.
No, thank you.
All right, next we have Owen Kingsley, WABI.
Thank you, Andy and Dr. Jarvis. What I wanted to ask was, are there any lessons you're taking away now that we're a week after the Thanksgiving holiday that can better prepare us from gatherings, from travel, that can better prepare for the remainder of the holiday season?
Yeah, Andy, thank you for bringing that up. And I was hoping that somebody would ask a question so I could address that. So we're very concerned about what the next week is going to foretell for us in terms of individuals who traveled or had big holiday events over Thanksgiving. We expect that we will see a continued rise of cases of COVID-19, and unfortunately that will result in more deaths of our family members, our friends, our citizens from this disease. And so I use this as, again, a cautionary tale. The holidays in December are coming up rather quickly on us. People want to go shopping. They want to be with their families. Again, this is not the time to be in close contact with other individuals, particularly those who are at the highest risk. People over the age of 65, people who are obese, people with heart disease, people with lung disease, people with diabetes, people with cancer, pregnant women, young children. I think I covered just about everybody in the state of Maine under that category. We need to look out for each other. We have to be good citizens. We need to care for one another. And the best way we can do that is to continue to mask and avoid those big congregate parties that we typically do around the holidays. Sad to say that. I often feel like the Grinch, but this is a time when I want the Grinch's heart to grow 4 times too big because I want to see us after the holidays not seeing the tremendous numbers that we're seeing in other states that are not heeding these warnings. If you look at the Midwest, if you look at the Dakotas right now, those citizens are struggling and the hospitals are filled to the brim. They're building facilities on a regular basis. We can prevent this here in Maine. We can do the right things. Mainers care about one another, and this is the way we show it.
Thank you.
Sorry, I got a little emotional there, but that's my touch point.
Thank you.
Thank you, Andy.
Did you have a follow-up, Owen?
Nope.
Oh, sorry, Owen.
Okay. It looks like New Center Maine has joined us, so I'm going to unmute you now, New Center, if you'd like to ask a question. The floor is yours. Going once? Going twice? Okay, well, I think that is it then. That wraps up today's news conference. As I mentioned, we will have a clean file to share with you within a couple of hours after today's event. If you'd like it, just let us know in the chat and we'll make sure to send it to you.
Thank you, everybody. And again, we appreciate you getting out these important messages to our communities.